Hello, Idaho. My name's Dennis Woody, and I'm a pediatric neuropsychologist working for Optum Idaho. We're actually participating in a 2-day seminar addressing the issues of screening for children having autism. Optum Idaho's partnership with ECHO Idaho has resulted in the development of a program to bring more training to our physicians here in Idaho addressing the issues of autism in the field.
So the problem ECHO Autism Communities is trying to solve is that there are lots and lots of kids with a question of autism, or their parents are concerned about their development, and there are not enough people to serve them and to help answer some of those questions. So ECHO Autism Communities is all about trying to help increase access to what we think of as equitable autism best practices, and diagnosis is one of those.
It's a mentoring program for primary care providers across the state to teach them how to diagnose and especially how to manage kids on the autism spectrum. So this particular session that we've been holding here is using an instrument called the STAT, S-T-A-T. It's a short 20-minute evaluation in kids from 14 months to 48 months. And it's teaching them to make the right observations and do this 20-minute test, which would validate a diagnosis of autism spectrum disorder. The reason that that's so important is that if we can make the diagnosis of autism spectrum disorder and not put people in long queues or wait lists to receive the diagnosis, we can lower the age at which they get a formal diagnosis of autism spectrum disorder and get them into the right therapies. So the earlier we start therapy, the better the outcome.
It's important because it's very clear that some of the therapeutic interventions that are already developed are effective in mitigating the effects of autism, whether it's language, whether it's social relationships, or even ability to tolerate stress. The earlier you start this intervention, the more effective it is in the child's development and capacity to fit at a typical level with his peers.
I didn't know the depth of the commitment of Optum Idaho for behavioral health support and especially the diagnosis of autism spectrum disorder. But all of these behavioral issues have a tremendous impact on our population, our citizenry here in Idaho. We need everybody pitching in. And Optum Idaho has just been an amazing partner in that effort.